Welcome back. Today we'll discuss a question several IMGs have asked us. How do you handle a difficult patient? This is a very important question for several reasons. First, you're likely to be asked this question as part of your residency interviews. Second, you'll actually deal with difficult patients very frequently as part of your physician careers in the US, starting with your electives or externships. And finally, you may end up meeting a difficult standardized patient in your CS exam. In fact, one of our students actually had this case as part of her CS. She had an encounter with an SP who was role-playing as an angry patient. The student had not expected this. She became very nervous, defensive, and did not do well in that specific case. Okay, so let's understand who are difficult patients. Patients can be difficult in different ways. For example, you may encounter patients who are angry over their situation or the care they are receiving. Patients who are angry may yell, curse, and sometimes even become violent. Patients who are demanding and never satisfied with the care they receive can also be hard to deal with. Other type of difficult patients include those who are defensive, combative, and non-compliant. So now you understand what it means to be a difficult patient in the US setting. Let's see how you can deal with them. First and foremost, we all have had experience with difficult patients in our home countries. So this should not be anything new or difficult to you. In the US setting, the AMGs of course do clinical rotations as part of their medical school curriculum and very frequently deal with difficult patients. For IMGs, the first issue is the lack of cultural exposure, at least initially. Sometimes we find it difficult to figure out if the patient is angry due to frustration with the system or due to some medical condition, or his expectations could be unrealistic. First, you have to be confident. Don't appear flustered in such situations. Then there are several other strategies you can employ to deal with such situations. Know the patient history. Knowing a patient's history before seeing them will give you a heads up on the situation and allow you to be better prepared. Then, try to understand if certain conditions have caused mood swings. You should of course be compassionate and show empathy. Being caring is an important part of being a doctor. It may be possible to diffuse the situation by remaining calm and talking with the patient. Use statements that convey understanding. When patients are frustrated and upset, it can ease the situation if they feel they are being heard. Ask what the problem is and listen to their concerns. Using statements such as, "Your frustration is understandable," can be very helpful. Remember, calm, reassuring tone can sometimes diffuse the problem. Also, let the patient tell their story without interruption. It should not take that long. Train yourself not to interrupt. This is an issue we frequently see with the IMGs. At the same time, you need to be firm. You may need to draw boundaries with the angry patients, clarifying behavior that is unacceptable. You can also try to find a common ground with the patient. Though slightly harder for IMGs due to cultural differences, talking about shared interests like college football may come in handy if you know what the patient likes. Another strategy is to try and make the patient and partner in decision making. Help him or her understand what you're recommending and why. Involve the patient family if possible. So all these small steps will help you bond well with your patients. Remember, in an ideal world, all patients you meet would thank you, be polite, and smile. But that's not always the real situation. If you've had to deal with a difficult patient, please share your experience here or any other question that you may have. As always, you can subscribe to our channel to get regular updates, visit our website to see how we are helping the IMGs, and connect with us on Facebook. Thank you.